In the wake of the COVID-19 pandemic, the Illinois Department of Public Health has this fall redoubled its seemingly endless campaign to urge Illinois residents to get a flu shot. Illinois Governor J.B. Pritzker has followed suit in repeatedly pushing the liability-free injection on a generally unknowing and largely trusting public. Since the height of the state's flu shot push in October, there has been a dramatic upswing in reported cases of COVID-19 and hospitalizations of individuals with severe illness, as seen in this graph presented in a recent WGN News report. Today, November 13, 2020, NBC News is reporting a breakthrough finding as to why some individuals have much more severe illness related to COVID-19, which may result in death. The NBC News article opens with a question that an emergency medicine doctor, Megan Rennie, has been trying to answer since the very beginning of the pandemic in the United States. What makes some patients so much sicker than others? The article goes on to describe the breakthrough finding as to the cause of severe COVID-19 related illness in some individuals. And I quote, "In an international study in Science, 10% of nearly 1,000 COVID-19 patients who developed life-threatening pneumonia had antibodies that disable key immune system proteins called interferons. These antibodies, known as autoantibodies because they attack the body itself, weren't found at all in 663 people with mild or asymptomatic COVID-19 infections. Only 4 of 1,227 healthy patients had the autoantibodies. The study was led by the COVID Human Genetic Effort, which includes 200 research centers in 40 countries. This is one of the most important things we've learned about the immune system since the start of the pandemic," said Dr. Eric Topol, Executive Vice President for Research at Scripps Research in San Diego, who wasn't involved in the new study. "This is a breakthrough finding," end quote. So, in follow-up to this breakthrough finding, a very important question to answer is what can cause an individual to develop autoantibodies? This 2012 paper is titled "Autoimmune Response Following Influenza Vaccination in Patients with Autoimmune Inflammatory Rheumatic Disease." It is peer-reviewed science and was published in the Sage Medical Journal Lupus. The paper points to one likely cause of autoantibodies for some individuals. Here is a portion of the paper's abstract. "Vaccines have undoubtedly brought overwhelming benefits to mankind and are considered safe and effective. Nevertheless, they can occasionally stimulate autoantibody production or even a recently defined syndrome known as autoimmune inflammatory syndrome induced by adjuvants. There is scarce data regarding autoimmune response after seasonal/influenza A H1N1 vaccine in patients with autoimmune inflammatory rheumatic disease, AIRD. The objective of our study was therefore to determine autoimmune response in a large group of AIRD patients vaccinated against seasonal and/or H1N1 influenza." The abstract of the paper concludes, although seasonal and H1N1 vaccines are safe and effective, they also have the potential to induce autoantibodies in selected AIRD patients and healthy adults. Follow-up of such individuals is proposed and further research is needed, end quote. Here's a recap of the most important facts presented in this video, summarized in short. While the Illinois Department of Public Health and Governor J.B. Pritzker have relentlessly pushed the flu shot on the people of Illinois, a 2012 scientific paper published in a highly reputable peer-reviewed journal states that although seasonal and H1N1 vaccines are safe and effective, they also have the potential to induce autoantibodies in selected AIRD patients and healthy adults. And now, as of today, November 13, 2020, NBC News is reporting a recent breakthrough finding regarding severe COVID-19 related illness, suggesting that autoantibodies that attack the body itself weren't found at all in 663 people with mild or asymptomatic COVID-19 infections, and that a notable percentage of COVID-19 patients who developed life-threatening pneumonia had autoantibodies which disable key immune system proteins called interferons. While this video consists mostly of irrefutable fact, let me conclude with one sentence of opinion. Health-related government advice and public health officials should never be blindly trusted, if they are to be trusted at all.